A round of applause from Republicans after President Donald Trump signed the budget reconciliation bill on July 4th, a day after the final version passed in the House. The so-called Big Beautiful Bill is already facing a lawsuit. We'll get to that in a moment. The legislation contains about $4.5 trillion in tax cuts, including no tax on overtime or tips, increased deductions for state and local taxes, and boosts to the child tax credit. It expands education savings plans and offers deductions on loans of American-made cars. The bill also increases spending on immigration enforcement and the military. One major pro-life win was the defunding of Planned Parenthood for 1 year. Pro-life leaders briefly celebrated the win.
I know it's not everything we want. It's only defunding Planned Parenthood for 1 year, and it's about 80% of their federal funds. So about $500 million they just lost.
The celebration was short-lived, however, because Planned Parenthood sued the government. And on Monday, a judge blocked the defunding for 14 days. The bill is facing major criticism for its massive reductions to Medicaid. Hospitals are warning the cuts could cause nationwide closures of rural hospitals. Democrats and church leaders say the impact will be devastating.
17 million people in our country, 17 million Americans in our country are going to lose their Medicaid.
Archbishop Timothy Broglio, president of the U.S. Conference of Catholic Bishops, issued a statement saying in part, quote, "The final version of the bill includes unconscionable cuts to health care, cuts to programs that protect God's creation. The bill, as passed, will cause the greatest harm to those who are especially vulnerable in our society," unquote. Daniel Cruz, co-founder and CEO of Presidio Healthcare, joins us now. He has written policy proposal papers advocating for excluding abortion from healthcare coverage. Daniel, can you tell us about the healthcare spending proposals you were a part of? What made it into the bill and what did not?
Yes, thanks for having me on. I worked for an organization called Paragon Health Institute as an independent actuary. As part of their research team that really formed a lot of the basis for some of these healthcare proposals that ended up in the bill. Now, the backdrop for all of the proposals is really that, federal healthcare spending is about a quarter of our overall federal budget. It's expected to increase and is really one of the primary drivers of future instability with our future federal budget. And so, proponents of the bill will say, and really the research concluded, that after the pandemic, federal healthcare spending rose about 25% from its baseline. That's about $1.9 trillion over 10 years. And the proposals really sought to roll back that $1.9 trillion increase in spending after the pandemic. And what the research found was that really two areas contributed mostly to that rise in spending. One was perverse incentives within these federal programs that allowed for waste, fraud, and abuse. And the second was really there was a loosening of eligibility requirements for people accessing both Medicaid and the Affordable Care Act marketplace. And so that's really what forms the basis of a lot of these proposals that got into the bill. The biggest one that is probably least controversial is the curtailing of what we call provider tax schemes, where states were taxing hospitals, returning the tax money right back to the hospitals, and then collecting the federal matching dollars that they would get through the Medicaid program. So that was really a bulk of the spending cuts there. Over $300 billion will come from that. The more controversial pieces are going to be the eligibility requirements, tightening them up. On one hand, they're asking the states to have more requirements, more check-in points for making sure people are eligible for Medicaid or for the ACA enrollment, which obviously is going to have an impact on families that rely upon those programs. But at the same time, it curtails bad actors like insurance agents that are signing people up who are truly not eligible, who sometimes don't even know that they're getting signed up for insurance, while the insurance agents are collecting a lot of commissions. Now, the most controversial aspect is the work requirements that are being added to Medicaid enrollees, specifically the adult expansion enrollees that do not have dependent children. That is probably the single largest amount of savings that proponents of the bill would argue for is a rational piece to it, but that's certainly the most controversial aspect of people losing coverage in those scenarios.
Now, the Catholic Church has sought to preserve the right to basic health care while responsibly stewarding resources. How will the health care provisions of the bill impact access to health care, and at what cost?
This is the big question, and this is, right now, everything is projections. The CBO projected around 16 million people may lose health care coverage through this bill. Part of that is actually not even in the bill. Part of that is just the sunsetting of what was enhanced federal subsidies on the Obamacare marketplaces that are called the ARPA enhanced subsidies are not being extended next year. Part of that is going to be those that are going to be subject to these work requirements. Now, just a reminder on the work requirements, they are only for able-bodied adults who don't have dependent children or illnesses. So that's going to impact, roughly 2 to 4 million Americans on those programs. But the bigger context is, especially for hospital systems, is that this is revenue that they will not be able to get anymore. A lot of these times, these people may become uninsured. And if they're uninsured, the hospital is oftentimes going to be writing off losses when they go to the emergency room. And so it's going to put a lot of pressure on our healthcare system, on hospitals that are no longer going to receive those funds through these Medicaid patients. So obviously, we have a balance of fiscal responsibility for future generations at the federal level. And we'll see where actual numbers come. CBO has overprojected many times in the past in terms of enrollment, but certainly there will be an increase in uninsured and more people are not getting access to these programs.
Well, Daniel, thank you for joining us today.
Thank you.